us a little rundown as to what happened last week. At the last meeting.
But we didn't have a meeting, in December.
I know.
Yes, okay. So, yes, and for, Lisa Etienne.
Oh, I'm so sorry, we didn't have everybody to introduce themselves. I'm so sorry. So go ahead and introduce yourselves.
My name is Karima Griffin, and I am currently a community resident member.
I'm Carol Barton, community resident.
And Lisa Etienne.
Thank you very much.
Yes, so, we last met in November. It was just me and you, right?
Yeah, and was it somebody else or just you and I?
No,
It was
just,
just you and I.
and Allison.
And Alice.
And Allison. Well, we did have a good discussion about, some things that we thought we could do this year. Going to the, shelters and residences and seeing if we could, possibly help with any, toiletries. And at the time, since we were looking for December, some toys and things like that. How can we, get a list of all those residences and see which ones could use our help the most and see how we can help them the best. And that was essentially the gist of the meeting.
Yeah. So, whilst I was out, I was still looking at the emails, and I think there was some sort of correspondence between you and Dante. Was there someone that you had to make a?
Oh, yes, so, we met with a fellow from, the mental health and hygiene.
Okay.
I think that's
Yeah.
where he was from.
Mental health and health.
And he was, if I recall now, interested in starting a program that would, help folks get to their, appointments. Specifically seniors. Specifically seniors. Should have read my notes before I got here. I forget, I wonder if I have it in my email that I sent to him. And it was for a particular case. Give me just 1 second. Look for it. He started, he had, was starting up a program at Maimonides, and he was interested in having that same program in the CV9 area. And what we had told him, was that, it sounded well, it sounded good, and I looked for my email, but, we need to see how it works in Maimonides, because they were interested in getting volunteers to help the seniors get to their appointments, but logistically, how would that work, right? And legally, how would that work? So,
Using their own.
that's the whole thing, right? Start it up in Maimonides, get some lessons learned, and then come back to us.
So it is a pilot program at the moment.
It's a pilot program, yes.
Because most of the time, while she is looking for the notes, most of the time how that works, you can't really schedule with somebody's own vehicle. So it will have to be on an outside vehicle, one of those umbrella, they have a company that will contract with them to pick up, because many a times, and which it really makes sense, because many seniors who are supposed to get to the doctor's office, sometimes they get there so late. Because that one driver have 2, 3 persons that they're picking up. They have to do traffic. So sometimes persons say, well, they go to the appointment late, or sometimes after they've seen the doctor, they're sitting at the health facility, at the hospital, or wherever the doctor's office. They're sitting there so late because that particular driver have to drive, drop home persons. So if that pilot program do work at Maimonides, and right now, Maimonides, they are on track right now with HMH will be taking them over, right? So they will become a city hospital very soon, so then we'll have to see how that's going to work, And it might work for them because Devon Mental Health, Hygiene, and HLH, they work, collaboratively. So they work together. So that's what that works.
And it was specifically for cancer, cancer diagnosis.
Okay. And I think it's something also they should, if they're doing that, I'm hoping that we can reach him, that he could come back again. Because
Yes.
when he do come back again, he'll have more information for us. So I'm hoping that maybe they can do it for persons who are going for dialysis as well.
But this particular program, the director, his name is Stephen Lee, he's in control of like the cancer prevention and stuff. But if it works for that, I don't see why not they need to expand it to some of the programs like dialysis. He did say that he would forward us a presentation, right? So we could take a look at it and also come back and we try to schedule to sit with us and talk about the program and how it was going at Mamadi's, where it is. But he did need to do a little bit more there before we can really bring it here.
Yes. And then, because sending a presentation is one thing, but I like to see the people in person, that they can present in person, and then we can ask some questions.
Yes.
Here and there, because I don't like doing a whole lot of reading and just looking at the screen. You know, so you know what.
Yes, but,
Yeah.
but that is the plan, him to send us some to schedule some time to come to us. But we have to time it when there's actually something more done at the Mamadi's hospital, and see how they develop that program there, pilot program there, and then come to us.
Okay. What's your profession?
I'm a registered nurse.
So wonderful, which hospital?
At
But also you are H&H. Wonderful. So, I was for a while, I was the chief for Miss County, so I sit on the executive board. Yeah, so right now I'm the outreach chair at Miss County.
They just had a camp meeting downtown, I don't know, I was there, I went.
At the CRC?
Yeah, I just went
Yes,
to.
so I'm always here. That's where I'm just coming from now.
Oh, so
Because
you,
we have our
you were
executive-
probably at the same meeting I was at.
No, the one that happened that meeting, I was in Nigeria.
Oh, okay.
Yeah, but I'm just coming from an executive meeting from there because we have our executive meeting the Thursday of
Oh,
every month
nice.
at this campus. Yeah, so so moving on, can I move on or you have?
Yeah, you can move on. I'm
So
still looking.
you're still looking, so when okay, so there are a few things that's really bothering me. So I think our last conversation when we spoke about I am not certain if I did, but we're looking to work with Kings County and the hospitals in the neighborhood. I think I did bring it up. Maybe yes, maybe no. Mental health awareness at the 61. So, and also for healthy eating. So, mental health awareness, it would be for the youth, the kids, the school kids. So, they will have a session for them. And then also, because I'm doing housing with them, I'm doing discrimination in housing, employment. Then I will be bringing somebody from Moya who will be doing something on immigration. And then also then we have the mental health awareness that parents know what to look for, the changes in the children, at home and whatever. And chime in, you're part of the family now, so just come in and just, don't just think that you're not. As long as you sit here, you become family. All right, so and then also for healthy eating, so Kings County has this unit where they have this, the food is excellent, it's good. I am somebody who don't like, my food have to have meat to eat. If I'm eating food without meat, I'm not eating. But then the way that they do it, it is so good, And then so I realize that I'm looking and we have a lot of our school kids, they're obese, right? And some of them, they have that underlying, they have the sugar, diabetes, it's underlying. They're eating so much junk food. And then so I'm trying to bring this, introduce it into the school, and then thankfully MS61 they are open to it, right?
As in like a healthy eating
Class, show them how
workshop?
to show them
Or
how to
cooking
cook.
demo class?
To cook them how to cook nutritious food,
Oh, I
Right,
did
healthy
that
food.
previously.
right? And it's a good thing, it's good. Sometimes they show you. Well, during COVID, I did healthy cooking online. During COVID, so we had someone from One Brooklyn Health, and then she did spinach with salmon. We wanted to get in the TV to get the food. It looked so good. So when I did the senior spa day, not the spa day, wellness fair. So she came and she did it in person. So whatever she cooked on in person, persons who were there, they got to it.
Okay.
So I'm looking to that, but Tuesday, today is Thursday, Wednesday. Last night, yesterday I was supposed to do a presentation over there. And then it's a good thing I went early, and then the coordinator said to me that a lot of the parents didn't come out. They refused to come out because of ICE. They're staying home. So we have an issue because ICE is in the community. Some people know, some people don't know. So right, they've been at the train station like 3 o'clock in the morning. Right there, right at the train station down there. So persons are frightened. So right now, coming from Prince County, I just spoke to them about having them to do the presentation online. So persons rather be in their home to do the presentation, and which I don't mind, because for the last year when I tried to do it, we didn't have many people coming out because people are coming from work and So, but when persons are at home, they can listen and then still do what they have to do. So I think we'll get a larger audience coming, taking part. So we're looking at that. So, and then
Would it be possible to do like a hybrid, like to have availability for people to come in person, but still have it online?
they don't want to come. We can do that, but then maybe I could talk to her. But they were the ones who went to
do it online.
ask to do it online. Yeah, they called the school and asked. So they said they want the information, but they don't want to come out. Yeah, so I don't think it would work well for them. Okay, yes.
I'm sorry to interrupt, just
Don't be sorry. Just
just on the same kind of topic though, is Kings County doing anything about the ice in the ED? And because we have a big problem with some of these hospitals, Mount Sinai, Bellevue, like they're in the ED and there's no policy, the nurses don't know what to do, they're treating them, they're, like a criminalized patient technically is a different category than ICE. This is a civil, this is not the same, they have a right to have visitors, et cetera, et cetera. The nurses don't know any of this, they're just listening to whatever ICE says.
so this is something that we just discussed tonight.
Okay.
Because I brought up this very same concern.
Yeah.
Because my concern is that when it comes to ICE persons who they have the children need to go to the hospital, they're sick. They themselves, they are sick and they need to go to the hospital and they rather stay home. They rather send someone to buy some bush for them, especially people from the Caribbean, because we believe in our bush.
Yes.
I'm a bush person. I love my bush. But when you have something a chronic ailment, you can't rely on bush because you might complicate stuff. So you need to go to the hospital. What do you do? Because they're frightened. And that was one of the things the CEO spoke about. So he has spoken to persons at the front desk. ICE come and they question you, you cannot turn away ICE, right? They will ask you for John Doe. So as soon as they come, that person who is at the front desk should not point ICE to where that location that person is. There is a number, they have to call that number right away. And then someone now will come and then talk to ICE. Now, let's say, for instance, that person who was arrested, because sometimes it may be someone who got involved in some issue, and the police have them, and sometimes, because how will ICE know that this patient is at the hospital? Someone would have to inform them.
I think that for the reports that I'm getting, they're usually being brought in by ICE, like ICE is injuring them when they're obtaining them. They're not like hunting.
Really?
They're breaking shoulders. Like I'm in peri-op. Like they're injuring them. And then they're bringing them in. There was a woman in California that I was on a campaign, and she had a miscarriage, and she sat for 8 hours zip tied before they thought, oh, she needs medical attention. And the nurses were freaking out, and like calling every nurse. That's how I learned about it, because everybody was just calling everybody, like, what do we do? And
There's a lawsuit.
well, the problem is, there wasn't a policy in the hospital, which the policy should be there's no ICE. Like if they don't have a warrant, they really don't have a right to be.
No, so it have to come to the judicial, how do you call it? It has to be signed
Right.
by a judge. So there were
Right.
2 of them. So there is a warrant that's coming straight from the office, right? And they can come to present it, and you don't necessarily have to accept them to walk into your home or whatever. But there is the one that they have to come with that is signed by a judge. right? So they show you that warrant, and there is you can't do anything. But then someone who's in labor, so at Kings County they have policy in place, right? So if they do come, so if you find that someone now, as a person is sick, they, the hospital responsibility is to care for that person, if that person came. And then afterwards, they said, okay, I want that person, maybe that person come in some time or the other, they're looking for that person. And then the thing is, when the person is well, then this person is ready for discharge.
But they allow them in patient care areas though,
So they don't allow them inside.
inside the,
They don't allow them inside. So that's the reason that when they come into the hospital and they go to the front desk to ask for John Doe, the person at the front desk does not have a conversation with them. There's a number that they call that number right away. And somebody come to them, somebody have a conversation with them. So they have, so whoever at the front desk will just refer them back to that person, and that's it. So even city agencies as well, because I just go to city agencies as well, you know. And then when they get there, whoever they go to will call GC, and then they will go to them to talk to them. Right. So
that's helpful, thank you.
yeah. So I think that I'm happy that you brought that up, because when we have a meeting with Central, it is something that we will have to do across the board.
Right.
You know, to have a policy in place for all hospitals, and it should not only be for H&H hospital, it should be for all hospitals across New York City,
Yeah.
that they have the same policy in place. Because Moyer, in BS office, so they have those guidelines that they give out, but we are not immigration officers, so we can't go out there and tell person do this and do that. So what they did, they have all the policies in place, and they have put trained personnel. So if I go out, I tell them, okay, we need somebody over there, and then they will come and then they give them every step by step. So this is what you should do when I come to your door. This is what you should do if I should stop you on the street. You know. So, but then I don't think person should be a prisoner in their home because of ICE. All you have to do is just encourage and just tell your people, and ICE don't do color. You know, when people say, oh, it's a black and brown community, I didn't have nothing about black and brown, everybody. They stop everybody. So everyone living home, always have your ID with you. Always have some sort of identification with you. Because if you don't have any identification, they will take you until somebody comes to bring some sort of identification. So that's what it is. So that's what we are right now. So whatever programs we are looking to do with the schools, you know, so we have to work with the PTA and the parents coordinators as well as to and so I want to partner. There are a few schools. There were Makiba. I would like to work with Makiba. The one at Park Place, I would like to work with them, you know, to bring the program, you know, because a lot of those schools, they have a lot of people from the Caribbean, you know, going to those schools. Some of them, they have the stuff that happened with the kids, and a lot of the kids out there, they are suffering from some sort of mental ailment. They are not crazy. They're just stressed. You know, they are stressed, and then they need a platform where they can talk. You know, so hence the reason I tell them I'm not happy with the fact. I think that for the kids we can go to the school, but for the parents want to be online. Because we want to be able to have them in sections where they're able to have a voice and say, this is what bothering me. Because as I told them, children and both of you are in the health field, children, they will not talk in the presence of the parents. The stuff that's happening to them in the house, they will not talk about it. You know, they will keep it in. And there's a lot happening, and they go on social media, and social media makes it worse for them. Because for my church, I had a week of prayer. And then I engaged the young people from 5 years. I said, they can talk and they can read. I engage them. Pray, read the Bible, do something. I get them engaged in the program. So I think I had like my child was like 6 or 7 years old, and she did a Bible verse. maybe 15 minutes into the program, YouTube shut us down. So we were like, why, they shut us down? And so the administrator would look to them, check why? So it's a good thing we had Zoom, but we're airing it on YouTube as well. And so then afterwards in the investigation, we found out that any child who is below the age of 16, YouTube don't allow them on the platform if they are not accompanied by their parents, by their guardian. And then we're wondering, so it was a policy that was implemented July of last year with the chat. This is Chat GBT, right? Chat GBT. Whatever happened on Chat GBT, the child on that platform, the child committed suicide. So Chat GBT was sued. So then YouTube now took, because they don't want to get sued. So the child is 16 and above, they can be on the platform, but then below that they have to be accompanied. So they had us down for a whole month or 2 months, and then we just came back. So we have to be. So the children, in their homes, they are going through a lot of stuff. So when it comes, we're looking at the health side of it, and then I want us to concentrate on the social aspect, or the social side of what we are doing as well. And we're looking at our seniors, and we're looking at our youth. So, Assembly Member Cunningham, I've been having a meeting because he wants me to form a task force in the community involving bringing in tenants association presidents, local association presidents, other organizations in the community who want to be part of that task force, the community boards, because there's a lot happening in the community, a whole lot happening in the community. And sometimes persons are telling you, well, what the elected officials don't know what's happening with you. Unless you go to them, and they're not going to come to you. You have to go to them to talk to them. So it's a lot. It's a lot happening in the community, and the elected officials, they can't reach everybody. So right now, so he asked to do is to create a task force. So this is what I would like us to do, to work on that. If you know the Block Association. Hello.
Hi, I'm Normal here for the meeting.
Yeah.
I'm Normal Leesway. I'm Normal Leesway Binding for the meeting. This is the health meeting?
Yes.
Okay, cool.
Oh, so this is Health and Social Services.
I'm sorry?
Yeah, I think you're in the right place.
Yeah, I think so.
Which committee are you looking for? Health?
Yeah.
Okay.
Yeah.
Okay. So you're welcome.
Yes.
Are you a committee member or board member? You're a board member?
Yep. I think I should be on there, right?
Okay.
Normal, you spelled Malazwe, but you have an R in it.
Okay.
Normal
Nice.
Normal Leesway.
Normally.
Normal Leesway or Nomi for short.
No R.
No R.
Alright. Wonderful. Thanks. Welcome.
For having me.
So we're looking at the task force. Alright, so to just bring people together, so we're gonna have a meeting, we have a meeting once a month or once every quarter. So whatever is that, I'm more or less looking at once a month. And we don't necessarily, because that's why I like us. I can't do it for another WhatsApp group again. I don't know the WhatsApp groups on my phone. I can't do it for another one. I wish there was another way that we can communicate. Because sometimes something is happening, someone has a problem in the community, your neighbor have a problem in the community, you can just pass it on, hey, so it's happening. And I can reach out and or call Brian's office or call this person, hey, this is happening, this needs to be done, and just get quick results, So we'll figure it out. Everybody come to the table and we'll talk as to how we can go about putting this task force together and how can it be effective. And I think that one of the ways that it will be effective is on the task force as to how many people join the task force. We will have subgroups, right? So if we have subgroups, I think that it will work better.
And yet the purpose of the task force is to listen to the community.
To the community, whatever is happening, yeah. So it's more like a community advisory group coming together. So block association, they have the block association on particular blocks. Things that happen in block association, they could come and say, hey, you know, this is happening, they could call and say this is happening on my block, this person, because even on my block, I live right there on Lefferts, I'm the block association president. One of the apartment buildings, the elevator was out for 8 weeks, or 8 months, I think it was 8 months. I didn't know about it. And no one said anything to me. And there was persons in there with babies, having strollers, having to walk up and down the stairs with a stroller and a baby. You know, those things, you know, it shouldn't be. Then you have the apartment buildings with no heat in the dead of winter, you know, and then persons are afraid to come out to complain because they're afraid of retaliation. You're afraid, but you don't want to say anything, leave it to us. We will take care of it because we don't want the landlord to, you know, come out and say anything. You know, so we have to, and I think that is a good idea because when Matthew Eugene was the council member, we had a task force. So the task force oversee the cleanliness of the neighborhood. You know, so they also have persons coming out, going out and cleaning the neighborhood, and then they got the trash cans, so you know, put it strategic area in the neighborhood. So then we'll figure out, because we live in our communities, in our areas, and we know what the need is there. Your need might not be my need, right? So that makes a difference. Okay, so the next meeting, the last meeting that I had with the assembly member, Community Board 9, our group, Rita Joseph Office, Assembly Member Brian Cunningham, Kings County, IDCC, Downstate. So we are all partnering to do this senior wellness fair. So the senior wellness fair, I think we mentioned this before, we spoke about it before. It was very successful last year, June. We had it on history of between Albany and Astroy, right? Because it was straight before Albany, Astroy. But it was successful, but the bad thing about it is that the school is right there. You know that there is a school across from the park. So the reason why we wanted to do it because we had the park and then we were looking to do yoga with the seniors. So we wanted to have that soft turf where they can use it, but in the school on the other side to Lefferts, the kids were playing, they had football and stuff, so we couldn't use it. So we actually was on the street. But what happened in the afternoon, when school dismisses, the buses will come in. So we could not really, we actually blocked the street, but we couldn't really block the street fully. So the first time that I did it a few years ago, when we did it on Lefferts here. Yep. It was quite a success because Karima have been with me from the time I started. Since 2019. No, not 2019, 2014.
14?
Yeah. 19 was COVID. Yeah.
2020.
Yeah, it's 2000, yeah, 2014, 2015, because I started the Block Association 2013 and I joined the board in 2015. And when I joined the board, that's when they threw that. So I wanted to do public safety and they threw this and I've been doing it ever since. Yeah, so we used to have our meetings out there. So 2015 we've been having our run and she stuck with me. So when we did it right there on Lefferts between Bedford and Flatbush. Now Bedford and Flatbush, heavy traffic. You know, so you find persons walking, they would come in. So we had about 25 organizations or more, right? So, yeah, we had a lot of organizations. And we have fire, so fire came, and then they were doing the CPR. Then we had, the name is right there, but they're doing massages. So we are looking to have to invite the Health First and Aetna. Now, I think Aetna, they provided a DJ, right? They provided a DJ for us. Dr. Love, she provided the food. So what we did, we had bags, we had over 200 bags of food.
Yes.
And then, so we had the food giveaway, and then we had the frozen food. So we had turkey, we had chicken, and whatever, and then we had fresh vegetables as well. So all the foods that came, they were stored at Grace Reformed Church. So the food would come in, so they bought the food the night before, the day before, which is the Friday, and some in the Saturday morning. And Karima was the one who was there making sure everything was okay, so they would just bring them out. I'll be able to put the food a little closer, because one of the residents, she's part of the association, so she has a garage at the back.
Oh, that's helpful.
Yes, so it will be right there, so we just have to go in and bring it out. So I will talk to Dr. Love so we can see if we can get the center to check in and whatever. And it was specifically for the seniors, so we give the seniors the fresh fruits they had, vegetables and fruits and everything, so, and then in the dried foods also. And apart from that, then we had all the different organizations. So it was like a health fair, resource fair, like, so everything was mixed up.
So it's Kings County doing most of the legwork and getting,
No,
so that's what we have to do.
we're doing the legwork.
Okay,
So it's us. I mean, everybody doing the piece. You know, because each one of them have their organizations that they know they have and they engage with, right? So if there is something that we say, we want somebody who could come and give information on mental health. So that person will say, oh, well, I have someone for mental health that I can bring in. Then I want someone to do massaging, to have a tent where people go in and do massaging. Somebody knows that. They know somebody to do that as well, right?
So what can we do? What is our?
So then our thing, we are looking at the organizations we want to invite. Which organizations we want. So we are looking at Dr. Love, then we're looking at the food stuff that we want. So we want the dry goods, then we want fresh fruits, we want the vegetables as well. So we're looking for persons. Sometimes we may not want to target that just one person, or that one person say, oh, I'll take care of it because she know her people, right? But then if we know somebody else, the more the merrier. Because after we had stuff left back, that then she took them and she brought them here, and then they gave to the people in the neighborhood, right? Because we had so much, left back. So our thing is then to sit down and think of the organizations that we're looking. So we look at all the insurance, not like Metro Plus, Health First, Aetna, and this is like for about 4 of them, because we don't want too many of them, because some, especially the Health First, the summertime is hot, and Metro Plus, sometimes they would provide tents, right? Right. So we don't have the money to buy tents, right? So therefore now we haven't really put a budget together. So before I left, we were supposed to put a budget, and I spoke to Dante and told him to put the budget together. So we have to think of the first quarter. What do we like to do for this first quarter? We're already in January, February, March. That's maybe you use this first 3 months to plan, right? And then where we go for the next quarter and the next quarter, right? And then determine as to how much money we're looking like. So if we are thinking that, because when we look at food, right? Everyone will be working there. Last year, what we did, we bought pizza. Not last year, but when we did it, we bought pizza. But pizza was for the persons who were table and everything. So the persons who were coming, they wanted pizza, so they had to hide the pizza in the front. Because everybody said, oh, can I have pizza? Can I have pizza, right? So, so we're looking at refreshments. So we're looking for donations from the elected officials for refreshment. So we're looking at everything that we will need, the organizations that, then we are looking at flyers to promote for promotion, right? To put the flyers together to promote it, because we want to promote it early on. Right? Blocking the street is not a problem. I can apply for the street permit, it's not a problem. The board could apply for the street permit, it's not a problem, right? So we have to get the permit, we have to, then we have to look at the date that we want to do it. Summertime is the best time. When it's hot, the seniors could come out, they could, sit and stuff. Chairs is not a problem, we can get chairs from here, we can get chairs from assembly members' office also, so that the seniors, when they come, we have chairs here, and there are about 30 chairs on the other side that we can bring chairs so that seniors could sit when they come.
I have a suggestion. This is out there, but have we considered reaching out to also the surrounding neighborhood is Crown Heights, Prospect, Lefferts, Garden, and where else?
So that's why we're planning to get all those people on board that we could, what do we want from them? How do we want them to partner with them? So that's why we're having this will be, so this quarter is our planning.
Okay,
What?
I was gonna say, have we considered reaching out to Monique Chandler Waterman's office?
All those people, so these are those people
And
that I
Zelma
work
Myers'
with.
office as well?
Those people that I work with. As I told you,
Okay, so
as I
you're
said to
already
you,
on top of it already.
yeah. So hold on a minute, sweetie.
Yeah, so-
How do I call you? I don't want to butcher you.
Oh, we say Nomi.
Know me?
Nomi's fine.
Okay.
Yeah.
So all the elected officials, anything that I do,
Mhm.
because the people that come in, they are their people,
Okay.
right? So I invite Monique, Farah, Rita, Selma, and Brian. So I incorporate them and event office as well. Right. So I target all of them.
Okay.
Okay, go ahead.
Alright, just so I'm clear, so we're at the first steps where we're organizing a fair that's gonna happen this summer, a health fair for seniors. Okay, that's step one. When we're doing this, we've done this before in a way. So our first step right now is to identify who we wanna work with.
So all the organizations we would like to come
Work
in
with,
will be,
okay.
because we want persons who come in to give out information that will cater to all the seniors, but other persons, there's not just seniors coming, but it's a senior wellness fair, so we want persons who will come in because we have different insurance coming. Your insurance, you may want Health First, something from Health First will be compatible for what you want, but not for her. So one person the last year, when we did it over there, said, oh well, you can invite Health First and then have Aetna, why not? Because Aetna may have something that I don't want, but then Health First come and Health First may want something. So we're looking at those insurance companies. So when they come, they don't just have the literature to give, but so they have little giveaways to give them as well. But then we want to be able to, when they look at the insurance. So last time we had, I think 2 years ago, you may remember, we had an insurance partner who came in and then he made a presentation. The presentation was awesome, right? And I was like, wow. I was like, when I turn 65, I would like to be in that program. But then there was a catch. There was a catch to it because at the end of the day, then in order for you to they come to your house, they wash your clothes, they cook, they iron, they do everything for you, right? They take you to the doctors, they do everything for you. So wow, this is a great program. But that great program really, it was not something more or less that they were looking out for the seniors. It was money, right? So then they look at your assets. You understand? So they're going into your assets. So if you had too much, so you had to be at that certain cap. So if you had too much money, then they was going to work with you to move that money, somewhere, somehow.
A different trust.
To be able to, so they were getting into your money, they were getting from you, they were giving you the service, but at the end of the day, they were benefiting. So our seniors in our communities, they have been working so hard. They've worked so hard, and the little that they have, the services are out there, but some of them, their families are not tapping into the services for them. They are not getting the services that they need. So we want, when they come out there, they get information that they're looking for, but then they're still able to have a little, how do you call it, relaxation. That they could sit down, they could, get a little massage, they can feel pampered. The last time when Diana was here, when she did it after everything, she had a movie. But then I don't know. One of the guys down there said, if you want to do a movie, I can do a movie for you. But then we'd have to have a tent, to do that. So we want them to get, it's a senior film, but at the same time we want them to be able to sit down and just relax when they have a day. And then after that, also in the planning, even tonight, one of the guys came to me and said, "Fran, when are you going to do the senior study?" So I did a senior study 2 years ago at Kings County in the T building. You know, so elite learners, was it elite learners or elite learners? So they provided popcorn and everything. So we had the first thing we had for them. We had we had a health talk for them in the morning. Then they did yoga. After the yoga, then they did bingos and they had prizes for the bingo. Then they get the manicure done. Then they had the massage. Then there is a barber to cut the men's hair. And then they had laughing yoga. And then then they had lunch. After lunch, they had a movie. They selected which movie that they wanted. They watched the movie, and then they had the popcorn, you know, and then they get the gifts, and then they went in. So, but it takes money. You understand? But so at the end of the day, we're looking at organizations who are able that we can get donations from them. So the person who did the manicure, the pedicure, manicure, pedicure. Okay. It was free, so nothing. We didn't pay for anything. All of this were volunteer, right? Person just came and then they gave back, and they did it. And the young lady we're talking about, she gave us 140 lunches. So everybody got the free lunch on whatever. So, and there are a lot of organizations that we can work with, that we can get stuff from.
Okay.
Hold on a minute. Did you finish?
Yeah, I was, no, I think you answered a lot of the questions. So I'm thinking of when the seniors come, I think of like, what are they looking for? So are they looking for insurance? Like, what do they, I mean, if I'm a senior and I'm going to the fair, and I'm thinking I'm going to this fair to grab information, to learn more things, I'm going to be entertained. Like,
Everything, entertainment, get stuff for.
What's their,
Yeah.
okay,
So, because we have a lot of our seniors in the community, they're on welfare.
yeah,
They're getting vouchers from the city. So some of them some of them have their own homes. So some of them when they come, they would ask, do you have anything on screen? For the health and something from the taxes.
The taxes,
Right.
yeah.
Right, tax exempt.
okay,
And some of them looking for ways that to lower the light bill, the gas bill,
Okay.
stuff like that. Even some of them, if they have health insurance, how they have better health insurance. So they get all those information that they want, but then they get a little entertainment at the same time. So we just try to wrap up it.
But is this wellness or broader than wellness?
So I just call it a wellness. I just call it a senior wellness fair. That's how I call it. We can rename it. It's open.
Right, because when I hear wellness, I think all about just health.
Yeah.
Right.
But it was not just, well, it was health, but we invited everybody. Yeah. So it's because we had people from the hospitals, right? So we had persons from One Brooklyn Health, we had personnel from Downstate and Kings County, right? For different divisions, not coming to do the same thing.
Right,
So
I
there
believe
was,
that's all health, but the talk about screen and other stuff.
That's
That's-
financial.
Right, it's
Yeah.
more financial.
yeah, so we had a little bit of everything. This is a resource fair. It's a resource
So
You
slash.
can still say
Yeah.
wellness, it would just be financial wellness, emotional wellness, mental wellness,
You
the
could
whole
be-
spectrum of wellness.
But
can we
I,
categorize it like sorry, I don't wanna cut people
No,
off.
no,
It's fine.
I was like, could we categorize it in a certain way where it's like, again, the wellness is a broad term, right? We all can, we're on sit in the same table against something different, right? So maybe perhaps we can categorize it where it's like, this is your financial area over on this
I
side.
think that's how you do it.
Yeah,
right?
but that's
This
how
is
we
where
do it.
we're-
Yeah.
Okay,
Yeah, so that's how we do it.
And
So
so
we
we-
have everybody,
Different sections.
so then they go in the different sections, so
Okay.
they there, they go there, and they, yeah.
I think calling it something that makes it more obvious what it's for, would also bring in more people,
Yeah.
right? Because if people are just focusing on health,
Yeah.
like I thought of,
Mm.
you only get those people. You may not get people who are looking for financial wellness.
So what would you-
But let me say something, in the community, darling, they don't even think of the wellness, they hear you have a resource fair. Because they already know what resource fair is all about. And they know when they get this, so they will just they have a
So
slew
it's a
of stuff.
wellness resource.
Yeah, so they can have social wellness resource fair.
Is health and resource fair then? Because I think more literal. You have your you have your wellness, you have your health conscious, your wellness, social, whatever, community related under wellness, and you have your resources where you get your information about your Medicaid or whatever. You have you get your
That
info
works.
about insurance. You get your info about tax exempt for houses or whatever bill, heat
Give them
bill,
information, give them
whatever.
everything. Let
So
me,
it-
Yeah, what about calling it holistic wellness fair?
holistic wellness. I
I
understand.
think that's still.
Still
under
still
wellness.
health.
Yeah.
That's- when people say holistic, they're thinking like acupuncture.
Yeah.
Right.
That's the thought process within that. Okay, I have another question. I'm not a question, sorry. So, let's say coming to this fair, there's let's say 100 people, or say 100 people. It'll be everyone's 80% or 65 to 75. Is it what we can identify like what they're most interested in, just so we can like gear it towards
Do a
what they
survey.
want?
Yeah.
Yeah, like a Google form where it's like, if I'm talking to a senior, I'm like, hey, Mr. Jones, if I went to a wellness fair, what would you be wanting to do? Like, oh, I want to go get a massage, or I want to learn about, or I can tell him what I think it is and what I'm most interested in, and that we can kind of see what they're most excited about to come, and then we can kind of move it in a certain way.
Right, and
Versus-
target those.
Yeah.
So
Instead
in
of
my-
having it so broad. So
in
it's like
my,
a free survey.
In
Yeah.
my experience over the years that I have been doing fairs, right? And the majority of those seniors who you see attending, they've been to hundreds of fairs in the community all over, because they know, they see, they keep their ears open as to where they have those things, right? And the majority of them, when they go, what do you think that they look for? Do you think that they're going to look for health information? Do you think that they're going to look for anything for street or anything? Right? They're not. They're not. They're looking for socialized and what free stuff that they get.
It's true.
That's what they're looking for. Every year I attend about 6 or 7, and I myself for my job, every year I would help other organizations put them together, and I have them together, and I have them right. I usually have my resource fair at the plaza, right? Hillel Plaza, Flatbush Junction, every year. So when they come, the first thing that they do, so you have the literatures over there, and then you have the bags and all the swags on this side. They come straight to the swags because that's what they're looking for. But when they do come to the table, because the very first time when I started working with this agency, there was a resource fair and Gateway
Mall?
not Gateway Mall, help me now, Wingate.
Wingate.
Wingate Park. And I was sitting there, so I knew nothing about. No one said, well, Fran, you have to go with swags or whatever. So I just had a table full of paper. Everybody passed me like I was in an exam. No one stopped at my. I think if 3 persons stopped at my table, I felt so bad. I said, what am I doing sitting there? And everybody went to the tables when they said the lotion, the pen and the
Lotion,
they had the
erasers.
sanitizers and the back.
Yeah.
Everybody, that's what they went. So now when they went to this table now, the people at the table now telling them, this is what we have and that's what you have. Then they say, oh, okay. Then they sit down and they say answers. So then I'm like, okay, I got it. So when they do come now to the table and they say, oh, what is this? And what is that? I said, well, I have this to give you, but information that I think that you'll be interested in. And then when I said, so then I would say, oh, well, you know what? I don't have problems with housing, but do you know anyone that I can get my taxes reduced? Or I want help with I said, oh, okay, I don't have that, but you can go to this table over there. There's a table over there. Because they're not thinking of, yes, if you do a survey and then they will tell you. But at the beginning, oh yes, but then when they go, it is not the mindset that they have. They hear wellness fair and their mind is just target free stuff.
Okay.
That they come to tell me, oh, what free do you have today?
Yeah.
What free? I say, well, I ain't got nothing free today. You got to buy something, and they laugh at me. So I really get into them, and I know, the right here, Mia can tell you, we had a fair out there one time, and then we had food, and we had books, and we had stuff. Yeah, do you know that people here and then they would give them stuff,
Mm.
and they went home,
Mhm.
and they changed, and they came back again, they came back again. So first the lady came and she had her hat and she had her, and then she came back. Oh hi, how are you? I said hi. I was so, I said, I just gave you some. Oh no, it wasn't me. I said, Mom, you just left here. And give you a big bag because Diana took it. So Diana was giving the food across the street, and we were giving the other stuff. And so they would go this way, that way, and they would change, and they would come back to get more stuff. So and that is one thing that bothers me. And then when they start having problems with the landlords, they start having, issues, then they run and then they expect you to perform a miracle. But you're right there, and then you're giving them an information. And instead of just saying, as everybody. And you give them the information, then they are not interested in it. So going back to making that long speech short. Yeah, so we can change the wording, how we, to suit it's fine with me. But then if I forget to ask you, what's your profession?
I'm a wellness consultant. So I organize campaigns in schools, so breaking them changing PE to more an athletic program in schools. I also do meal coaching, so people who are pre-diabetic and diabetic or personal conditions by just meal coaching. And then sometimes I have a couple of run clubs and fitness.
Okay, so you fall right in.
Yeah, I'm in. I do everything.
You looped
I
in
do
with
everything.
it.
So like I said, we're called Project Formation. So our goal is to transform public health to be more.
So that's what we're trying to do. When before you came, that's what I'm trying to do in the schools. To get into the schools.
That's why I started answering it's
Yeah.
easier. I'm a DOE vendor as well, but I try to enter charter schools because they're a
Right.
bit more flexible. But just showcasing, hey, this is a pilot that works. Let's see what we can do here.
Yeah.
So sometimes I bring in healthy food chefs to help the kids learn how to prepare healthy snacks.
Yeah.
Oh yeah.
Yeah,
Yes.
literally 10 minutes
Yes.
before you got
I
there.
Oh,
think
so-
it would make it easier.
Yeah, because
Because in my mind, I'm like, oh, this is so much, doing that.
So that's how we have to break it down.
Yeah, how we
Yeah.
can break it down, but if we have somebody here that can help us along.
Yeah.
yeah.
It might make it a little
Easier,
easier
yeah.
to get through all of that. And even if it's not all in before June,
Yeah.
we can still work with
Yeah,
it.
you just work it out. We just go down because we might not be able to accomplish everything for the year,
Right,
but
right.
then we look at it and then we itemize it, we put it on paper, and we say which one we think that is the most important that we should start working, and then we start, we move it.
Yeah.
Yeah, that's what we do. Yeah.
That's how we try to
Okay.
move. Yeah.
Something my job place did last year, one of our STI clinics in the Bronx, Morrisania, what they did, they had a health fair last year that they had all these different community organizations in the Bronx. What they did was they kind of did something like a bingo thing, that each station had a different color. And when the guests come in, you give them a little blank thing where they have to go to each different,
And then
they put a stamp on it,
Yeah, we do
and
that too. Yeah.
only at the end of, if they complete all of it, then they come back to the end of the evaluation table, whatever, for lack of term, and we give them a swag, whatever.
Yeah, because just to really get them to
So maybe we
make
could
sure that they
implement
go to
something like
every
that.
table,
Right,
to
right.
get their stamp. Yeah, so we do. Yeah, we've done that as well. Yeah, well, I didn't do it.
Right.
Other organizations that we worked with, they do it. So that's a good idea.
Yeah, so maybe that's something we can implement that would probably also prevent them from grabbing stuff and then leave.
Mm-hmm. And then there is this guy. There's this is a health person, Fulton Street, and they would have the bingo thing. So they have the wheel, and then you would spin the wheel, and then based on where you
I like
stop.
bingo.
Yeah.
Yeah, because there are persons they come on your table and they want to pick
No,
up
they like
everything.
that. Yeah, that's fun.
Yeah, so
Sometimes I can
yeah.
entertain them by that.
And let me hear your input. You only have one question, and you are listening. Let me hear from you. What your
I teach adjunct at SUNY Downstate for nursing. I'm wondering if I could ask the professor, the dean over there, maybe we get the nursing students to do blood pressure screenings and stuff.
so I work with Downstate as well.
Oh, you know?
Yeah.
Oh.
So
Really? You're a nurse at Downstate?
I just teach there 1 day a week. I work at Bellevue.
Gotcha. They're
So-
my graduate alumna.
Oh, nice.
yeah, so I don't know the vice president, assistant vice president. I just had a meeting there.
Oh, okay.
So I just got an email from one of the professors
Oh, okay.
because I usually whenever they have or the symposiums. So I would speak at the symposium. So they just send one to attend. So I work very closely
Oh, that's
with Domesday as well. So that is something you can do on your
Yeah, I can reach out, yeah.
yeah, because Alicia, she would talk to Health First and Aetna because she has a very good rapport and working relationship with a lot of the organizations in the community. So we work what time is it? 8 o'clock, so we can't even complete. This is what's a wonderful meeting. And because we Downstate, we are doing this mental health forum.
Okay.
A 3-part mental health forum, and we spoke about that last year. So we'll be doing it for general, then we're doing one for children, right? So, but the one for the children will be at the Wingate Park.
Okay.
So we'll have sessions, tents where they have sessions. They could come in and then they could talk, and then so Zelno Myri's office, the in charge of that part, and then in November we are doing a wellness for men, mental health for men. Men
Oh,
don't
yeah.
talk about nothing.
That's the month for it, November, right?
So they men can't take about everything. You know I talk about that before, right? Women talk about everything.
The conversation.
Yeah, women talk about everything. We not all women. Some women still go back. So, but the majority of us we talk when we have issues. We have a girlfriend. It's a girl, but men just keep things in, And then you head into the sick. They fall down. They have a stroke.
Maybe if you can get free tickets for a good game.
That's a good idea.
Yeah.
Your bingo
Yeah,
crowd.
yeah.
Yeah.
It's a good idea.
Oh,
Yeah.
I'm sorry, just one more question. You said for the wellness fair that there's gonna be like immigration resources.
Yes.
Is there an opportunity to do like know your rights training there as well?
There no.
No.
It will be. I think it's something. Maybe we can have persons. Well, you may know your rights for what? For housing or.
No, like, I mean, because I've been working with like a lot of healthcare workers that have been doing, just for healthcare workers to teach patients or, whatever, and like you were saying, the judicial warrant, and you don't have to open the door, and here's a
Okay.
number you could
Yeah.
call in
Yeah.
Brooklyn,
So those things that they can have a table where they can have Moya to come in,
Mhm.
and people can go to the because for Moya I would like them to have their own tent because just to give them the privacy. So one
What does Moya do?
Mayoral
Mayor
Office of Immigration
Affairs. Mayor Office of Immigration Affairs, yeah. So I would give them their own tent.
Yeah.
So then the only one who have a question that it's more private, then they can go in there and then they can talk.
But because you said know your rights, maybe we can have a table that someone can talk about Medicare,
All of that will be there.
Medicaid,
Yeah.
things like that.
So when you talk about know your rights, because I'm a human rights specialist, so that I see differently.
Right.
Because know your rights in housing, employment, when it comes to medical, anyone violating your rights, someone discriminating against you, and you don't know that someone is discriminating against you. You don't know someone is violating your rights. So it could be at the hospital, the clinic, or anywhere. It could be right here where you go to school. So it's and we cover over 37 different categories of violations, but persons who violate your rights. So when you say know your rights, that's my mind just go like this based on what I do, right? But then when it comes to giving information, on Medicare and then so we have all those organizations. They come and then they will be there to give persons to get all the information that they want.
So
It's 8 o'clock and I don't want to keep doing it. It's 8:02.
we just have to figure out a date, right? And a place where we can get a permit,
So get a what?
a permit, so we can have the fair.
Oh no, that's already taken care of. For the resource fair?
Yeah.
No, the Radiant Church on Leffords. I had already spoken to them, so I told them that we will not be doing it over there. We'll do it on Leffords Street. And so it's just up to us now. Have to come back to the table, right? And then say, okay, this is the month we're looking to do it. So then, as long as we put the month together, we agree, and then we start putting the flyer together. I already spoken to the lady from Downstate, all right, Alicia, and Brian Cunningham's office. So we all said, okay, yes, this date is fine, we'll start putting the flyer together. So as I said, this month, this first quarter is our quarter we will be planning, you know, and then so okay, this is what we'll do for this first quarter, and then we'll move, because for me, my drum is full, right? But I'm happy for you guys. You guys that I know that I'm gonna give that, because I have a new boss, new mayor coming. I have a new commissioner. My director, he left, so I have to keep the office running. Right? Then I have to be doing things county stuff. You know, then I have to be doing shit. So it's a lot. And I'm planning for my second wedding in April. So it's a whole lot of stuff I have going. So this committee, it's just, how many of us on the committee?
7.
Seven committee members.
That was yesterday. 10, 12.
Rachel, Gina. 7. Okay.
Now that's eight.
Hmm?
This round is eight.
Yeah, right?
Oh, 9. What's your name?
Carol Bartley.
Okay, so I think it's about 9 of us on the committee. So at the end of the day, we can split and have 2 subcommittees. Right? We have 2 subcommittees, and one committee will be planning to. If you need water, there's water.
Yeah, I've been drinking
You
a
have
little
water?
bit here.
Yeah, so we can, we'll look at what we want to accomplish this year. The second quarter and the third quarter, and then we'll split. So we'll have one group working on this, right? And then the other group, you know, then we'll come back and work it out. For the fair, I mean, although we'll be working on different things for the fair, but at the end of the day, everybody come together and work together and make it happen. Right? So in my absence, you know you are the person in charge.
Okay.
So you have your person taking, because you've always been doing it, taking notes. So you have your person.
That's a day.
I know you didn't do it, but she have your, if I'm there, she can't do it, because I don't want it stop if I'm not there. You understand? So I just need the momentum, I just need it going. So if I'm not there, the meeting will still be called, you'll still conduct the meeting, she will take the notes. And it's the reason why I don't like just one person doing, and when the person is not there, everything just done. So this person is not there, so I want it to keep going. And then this crew here is just a great crew. I love her. You know, so we can make things happen.
One other thing before we go, we have to make sure we approve the November minutes.
Hmm?
The November minutes.
Do we have it?
Yes, we have.
You know that's what I'd asked you to do before, right?
No, I went through what we.
Oh, but we didn't approve
We
it?
didn't approve it.
Oh,
So I want to make sure that gets done.
okay. So there are a few things on there we didn't touch. The senior centers, so we have a whole lot to do. So we have the senior centers that we're looking to get to them, but next month we can, it's already after 8, and we talk about a lot tonight. We covered a lot. Alright?
Because
So-
there's so much to do.
Yeah. So based on the, I'm assuming that you read the minutes, right? So, and the motion is on the floor to accept the November's minutes. Motion on the floor?
Motion to accept.
Second?
Do you have to be here in the back? I wasn't here.
No,
Same.
there, but you're still reading it.
Does it make sense?
It makes sense.
Okay, so minutes are accepted, and it's into record, and it is accepted as is. Okay? Alright. So next, our meeting for this month, so by next week, and then you can, as you did before, you just send them a copy and then send me. And then what you can also do in our chat, so, okay. Can you take her name? To add it to, because I'm gonna make you admin to the chat as well. Yeah, I think you admin in the chat. Under the thing, yeah. So, alright. So give her, yeah, take both of, you have it on there. Their names, and add it to the chat. you know, so that they will see what it, because you see the text message that comes in, right, because you are part of the chat as well.
Yeah.
Because I think, yeah, so whatever that, you know, anybody have any news, anything come up on this stuff, and then they want to say, hey, this is happening or whatever, just put it in the chat. Okay. Yes. Yeah, so that's where we are. I think you guys so much have a great rest of the week, a great weekend. And if anything come to your mind as you look and say, oh, I think of this organization, I think, just put it in the chat. Just put communicate before we Thank you so much and welcome. Yeah, you look so familiar, like I've seen you before.
Yeah, I bet you I've seen you in the halls.
We are more or less over there.
Yeah, it's possible.
On Monday night.
Bam at last place Ashland.
Yeah. You can Google and they always show
Where's your empty tissue box?
a documentary